My name is Dr. Vincent Minjares, and I'm a program manager with the Aspen Institute Sport and Society program. Pleasure to moderate this next session on health equity in youth sports. We have an amazing panel here, so I'm super excited to introduce. I'll just say this as we get into this. The notion of health equity is a really important one. As we grow access to sports for kids in this country, as we continue to prioritize their experiences, we have to make sure we look after them physically and mentally. And this conversation is about really elevating our awareness and understanding potential solutions around health in youth sports so that we can follow through on our Children's Bill of Rights call to ensure that young people have access to safe sports environments. To help me get through that, we have three esteemed panelists. Coach Mike Locksley, who is the head coach of football at the University of Maryland. Thanks for joining us, Coach.
Thank you. Thank you.
Dr. Marci Goolsby, she is the sports medicine physician and the medical director of women's sports medicine at the Hospital for Special Surgery. She's also the director of sports medicine for the WNBA and the immediate past president of the American Medical Society of Sports Medicine. Welcome, Dr. Goolsby. And Dr. Mayrena Hernandez, who's an assistant professor of athletic training at Sam Houston State and the director of the Healthy Activity Toward Promoting Injury Reduction Lab there. Welcome, Dr. Hernandez. Coach, we're going to start with you. May is Mental Health Awareness Month, and I think it's an important place to start our conversation. You've been really active and frankly very public about mental health and your advocacy around it, your experiences with it with your family. You just held a mental health symposium on campus just this weekend for your fraternity and for many student athletes. Help the audience who doesn't maybe understand your story understand why this is such an important issue for you and what's driving you to act around mental health.
Yeah, it starts with failure. I had a son, Miko Anthony Locksley, who was a Division I football player, played for me at New Mexico. When I came back to Maryland, he ended up finishing up at Towson State University, and he dealt with mental health issues before he was killed in 2017. And for the first time in my life, mental health never affected me. And now it was really personal for me because I saw a son that was a normal football-playing Division I football player at the age of 21 struggle with understanding myth from reality. And it just happened just almost like that for me. And when I saw the look in Miko's eyes as he struggled through mental health, I saw the same look that I saw in Tony O'Conowon, who played for me at Maryland in 1998. I saw the same look in Trayvon Bellamy, who played for me at Illinois in 2007. And it's that look where you can almost see a person's soul. And because of that, and going through what we went through with Miko and his struggle, he was diagnosed with schizoaffective disorder, and trying to find ways to provide the resources for him opened up doors for me that I said to myself, I've had a lot of football players over my 34 years that I've seen that look, but I didn't recognize it. And because of that, it is the tragedy of losing my son, which may have been attributed to his mental health issue, has motivated me to take care of the 18 to 22-year-olds that I've had the opportunity to develop from boys to men.
I think the platform that you have and the openness that you have around these issues is really powerful and really important. I think it's worth sharing the ways in which you've approached this on the ground in your program, because I think it's one thing for us to talk about it, it's another thing to do something about it. And, you've done quite a few different things in your program as the leader of young, predominantly men of color, who we know sort of in terms of issues of stigma around mental health, feeling vulnerable, being willing to seek out resources and needing help. What are you doing in the program around mental health?
Yeah, when I got hired in 2019, we had just lost a player. Jordan McNair had died on the field there, and so I had inherited a team that had just lost a brother, and I had lost Miko in 2017, and so it was almost like two worlds colliding to heal together. And through that experience of helping my own kids get over the death of their brother, here I inherited 120 players as I left Alabama to come take over at Maryland. we had one mental health professional that worked with our football team, and we have 120 players. And as I found as a first-generation college student, first in my family to graduate from college, a lot of the kids I coached that look like me growing up have a lot of luggage that they have never unpacked. And to be the best version of themselves, which we try to get them to be because of the time they spend in our program, I thought it was important that if we're going to attack the physical development, how do we attack the mental development? And Dr. Yvette Rooks, who's our team physician, I approached her about adding more people. So now we have 5 full-time mental health professionals. And it's not just dealing with the mental health, it's anxiety, it's sports performance, it shows up in a lot of different ways. And, you know, to be able to add 4 new people to work just with football. When our players and new coaches join our program, we have an exercise we call the 3 H's, where you have to stand in front at the end of practice, where we have the normal huddle where everybody comes up. We have everybody kind of give their 3 H's, what's the happiest they've ever been in their life, what hardship they've faced, and who the hero was. And that way we get to personally know them. And we have an open door policy when it comes to the mental health piece. And again, having been a caregiver of an 18 to 22-year-old that struggled, it's real for us in our program, and we talk about it a lot. This June, in the state of Maryland, they just passed a bill where all coaches will be trained in mental health awareness first aid to be able to see that look. Every one of my coaches will go through this training. We're going to spend 2 days in June to go through this training to provide us with the resources to help the young men we get an opportunity to coach.
Yeah, you know, for those who don't know, and I referenced here, HB 2024 has passed both houses in the state of Maryland and is imminently ready to be signed by Governor Moore. We're seeing more states embrace mental health literacy requirements, mental health training requirements for coaches. I think we can probably appreciate that, you know, Division I institution is different from a high school coach. So the question really, Coach, is when you think about high school coaches, youth sports coaches, what is their responsibility from a mental health perspective? You know, talk to that community who obviously is in a slightly different place.
They're on the front line. I mean, again, to see the look in Miko's face and then remember that look on former players that I had no idea what they were going through. The coaches to be trained to recognize those triggers or those examples of what it looks like. Really important. It's really important to create a safe environment where mental health is real. I know in my community, I grew up in the southeast section of D.C., you know, nobody talked about mental health. It was your aunt had a mental breakdown, or your aunt, you know, is not feeling well. Well, what does that mean? So we embrace it. You know, we make it easy to come in and talk about it. And I think for coaches, our role, you know, Kevin just talked about building young men through sport. Well, you know, the sports goes all the way back to the Olympic times where it was just that important. And when you think of the role that a youth coach plays on the front line, that is the initial development. We teach blocking, tackling, running, catching, throwing fundamentally. Well, how can we teach the mental health side of the mental development of these young players?
Yeah. Thank you, Coach. Yeah. You know, for those who aren't familiar, the Million Coaches Challenge is an initiative that's been promoting and actively trying to train 1 million coaches in issues of youth development, including mental health. This is something we've been very active on. Coaches, get trained. Thanks, Coach. Yeah. Dr. Goolsby, as a physician, you see young female athletes every day, and you're acutely aware of their health needs. Let's start with one in particular, ACL injury. I think for folks who've been watching and paying attention to the World Cup last year, you know that this is becoming a hot button issue in terms of female athlete health specifically. From a high school athlete perspective, 26% increase since 2007, with rates highest in girls, particularly cutting and landing sports. I'll give you one other piece. Girls soccer actually has a higher ACL incidence rate than tackle football. And girls lacrosse has grown 80% in the last 15 years. Most folks understand this is a serious injury, but help the audience understand, what makes it so severe, particularly for female athletes, and what's really happening here in terms of why these non-contact injuries are going on.
Yeah, thank you. It's great to be here. One of the things that you didn't mention in my introduction was I was a basketball player myself in college, and so I had definitely a front seat to the impact of these injuries and some of my teammates. Knock on wood, I still have both of mine. But I'm also a parent, and I'm a coach of my 11-year-old daughter's basketball team, and in my office practice, obviously, I see a lot, and I see the impact. From an injury perspective, over half of the people don't get back to their sport, and it's higher in girls, and we already have an issue in losing girls from sport in their early adolescence time, which is incredibly impactful, as we heard this morning from Under Armour, what that can mean to an athlete in terms of their identity, but also in terms of just, they're getting through high school. The psychological impact, the mental health impact can be incredibly significant, and just the social aspect, which is incredibly important. They lose that identity, they lose their social network in a lot of ways when they're out of sport. It takes 9 to 12 months on average, and like I mentioned, they often don't get back to their sport, and it's higher in some sports than others, like lacrosse. In women's soccer, which we see a lot of these injuries in, it can be incredibly impactful. We also see, unfortunately, the post-traumatic arthritis. So it's almost a guarantee that if you tear your ACL as an adolescent, within 20 years, you're going to have arthritis, and oftentimes severe arthritis, end-stage arthritis, and the need for a knee replacement, sometimes at a very young age. So the long-term impact of that, of course, like in that immediate time frame, them getting back to sport is what they're thinking about. They're not thinking about what their activity capacity is going to be 30, 40 years later, but that's incredibly impactful when we talk about chronic disease prevention and just health through the lifetime, is the impact of these injuries on them as an adult.
It's interesting, the National ACL Injury Coalition, which is an initiative that Aspen and HSS has really been working hard on, has focused a lot on this concept of neuromuscular control training or neuromuscular training. And it's interesting thinking about the complexity of this injury, because you have a lot of different potential factors, but there seems to be a lot of research around this kind of preventative work. This is a simple sort of solution that is based on 2 decades of research, and sort of says that if you engage in this process of training, you can actually reduce your risk of injury. Can you just talk a little bit more about neuromuscular training, and specifically this new app that HSS has developed, which is trying to address that specific issue?
Yeah, I like to say this when I'm teaching residents in my office in sports medicine and medicine in general. The what can often be the easy part, but the why is the part that's really important. And so there's a lot of research. We still need a lot more research, I think, on why these injuries happen, but neuromuscular control is certainly the top thing that we've discovered as to why these injuries occur, and why they are often occurring more in females. And without getting into all of the nuances of like the hamstring versus the quad strength and those types of things, it's basically how they move. And trying to teach these movement patterns at an early age for prevention, we know works. So how they land, how they cut, how they stop. Most of these injuries are non-contact, up to over 80%, I think, in girls lacrosse in particular. And so being able to have that neuromuscular education is incredibly important. And what's kind of a travesty is we know it works. Like you said, there's 2 decades of research to say that they can decrease the injury prevention, sometimes up over 80%. And but why aren't we doing it? Only 20% roughly of high school coaches actually implement any of these programs, and 10% do them correctly. And I think there's a lot of reasons why that may be, and there's a lot of great programs that are out there, like 11 Plus and KIPS and others. But I think the implementation is the hardest part, and the barriers to that can be multiple. Some of it is time burden, some of it is they feel like they need a specific kind of training, or it should be led by certain individuals. So HSS developed an app called RIP-Reps, and RIIP. And the idea is that it's free, and it's targeted towards the coaches of the leagues, with the athletes being assigned the exercises. So it's 7 minutes of exercises done 4 times a week. The coach or the league sends it out to the players to do on their own. They can certainly do it within practice if they want. They can check compliance of their athletes, and it doesn't require any special equipment. It doesn't require any special training. There's cues built into the videos, so that's another reason that sometimes the implementation has been difficult, or the success of the programs is the need for some verbal cues to make sure the movement patterns are correct. So we're really excited about that app and sort of its opportunity to be a little bit more impactful, hopefully.
Yeah. Thanks, Dr. Goolsby. Some of you may have seen the Rip Reps station yesterday out in the gym. It's an interesting app. I've done about 30 exercises of it myself.
I did it with my CYO
yeah, did you
team.
give it? Yeah, you gave it your try. It's worth an exploration because we're trying to find different ways to get to reduce the barriers and to get folks doing some of this preventive work. Thank you, Dr. Goolsby. I appreciate it. Dr. Hernandez, secondary school athletic trainers, a unique space in the healthcare system. You're a researcher of athletic trainer. You're a professor of athletic training. You really have a deep appreciation for the role that athletic trainers play, not just in injury prevention, but in community. The challenge is that only 1/3 of schools have a full-time athletic trainer, and that's particularly problematic in low-income communities. We know that statistically, the higher the median income, the more likely you are to have an athletic trainer. The lower the median income, the less likely you are to have an athletic trainer in your school. Help us understand why athletic trainers are so important to low socioeconomic communities. What makes them so special in those communities?
Yes, of course. So athletic training is very near and dear in my heart. As me being an athletic trainer by trade, I know that athletic training can impact youth sports lives and keep those athletes in the game longer, and make that experience a lot more positive. You gave some stats on how many athletic trainers are located in the high schools in the U.S., and it's around 65% of those high schools have access to a full-time athletic trainer. And then of those 35% have that full-time athletic trainer. So 65% have somewhat of a capacity of an athletic trainer. And it's so important because athletic trainers, especially in the secondary school setting, are at an optimal intersection in public health. So not only are we providing healthcare to these athletes, but my research has found that we're a resource hub alongside coaches, administrators, the team physicians for those school districts, to be that soundboard for that athlete and their own families, to provide them the best healthcare and resources for those communities.
Yeah. Talk about that a bit more, because I know you spent a lot of time talking with athletic trainers who are in predominantly Hispanic communities. Some of the work that they do to provide what you, I think, called equitable healthcare, right?
Yes.
Talk about some of the strategies, some of the barriers that athletic trainers in the communities you were working with. What did you learn about that work in those communities?
Yeah, so in my study, it was a mixed methods study where, of course, we did that whole data analysis, but then what I thought was really unique was the qualitative component of it. And so I got to hear athletic trainers in the secondary school settings, their experience working alongside other stakeholders and navigating those challenges related to their patient's socioeconomic status. And ways that they were able to do that is just being a good listener, listening for cues, understanding mental health components and issues that might arise, of course, implementing those prevention programs like Dr. Goolsby was talking about, but just being aware and alert for anything that were to happen ahead of time. And so anywhere from cues of that they could notice that their cross-country athletes were, one, getting injured, but they were wearing the same torn down shoes, so they weren't getting the adequate gear compared to their peers, or they noticed that, oh, this kid, he's taking the bus instead of having a new car like all his classmates are. And then surprisingly, some of those kids are really good at hiding those things so that they can assimilate with their peers. And so the athletic trainer is able to really tap in and gather those clues to figure out, okay, is this athlete going through some of these disparities in society compared to their peers?
Yeah, it's really interesting. I had found that the insurance piece was something
Yes, that is massive.
Right, yeah. Just mention that really quickly.
Especially, so as an athletic trainer, we provide pre-participation physical exams, and so those are very important to catch those medical conditions that could be catastrophic and life or death situations in games and even practices. And so, but the first thing that we have that is on that PPE is that insurance status. And so someone being uninsured or one of those free insurances could be a telltale sign of low socioeconomic status.
Yeah. Solutions. I know that it's hard in 2 minutes to try to figure out how do we solve this issue. But Team Heal is an interesting potential sort of model that we can think about. It's operating out of LA. Can you tell the audience a little bit about what Team Heal is and what makes it novel in this space?
Yeah, Team Heal is fantastic. It's based out of LA. One of my colleagues, Alejandra Merriman, is one of the athletic trainers in their 5 original schools that were from Team Heal, and I wish that was located where I'm at, which is a very rural area in Huntsville, Texas, and in the North Houston area. So more programs like Team Heal need to exist because it offsets the high school hiring the athletic trainer and utilizes hospital systems to get those athletic trainers out to those high schools so that they're there full-time and not only part-time or only these certain hours, so that they're there covering and providing that health care to athletes all the time.
But the athletic trainers are also teachers
Yes.
in the school.
Which is great because they infiltrate there and set that stage for getting more curious minds involved into sports medicine to go into either athletic training or to become physicians or coaches that are well knowledgeable in those topics with injury prevention.
Yeah, check out Team Heal. It's a really interesting sort of methodology of trying to do using athletic trainers not just as service providers but as teachers in the school who are then also developing an internship team of students who then support the athletic department and then get career readiness support. I think it's super fascinating. So unfortunately we're out of time. Thank you so much to our amazing panel. Well done. And look up this amazing group. I know that some folks have to go, but follow their work and let's continue to have this conversation. Thank you very much.